I didn't think that I'd get myself off the transplant list, but I did think that I could maybe have a good quality of life in the meantime, or maybe delay the referral by a few months. And in the back of my mind, I was thinking it would be amazing to run 10K for charity, for the CF Trust, even though I'm on the transplant list, even if it takes me 2 hours and I need oxygen. I just thought it'd be a good victory for me over something that devastated my life. So I did start training. I reached out to mainly the physiotherapists that were looking after me. I reached out to Johan because I knew that he'd succeeded to battle his disease and do things that he shouldn't be able to do with his condition, in order to get the information that I could and the support that I could. And subsequently went from being on oxygen 24 hours a day, needing a ventilator at night because breathing was just so tiring I couldn't do it anymore, being unable to walk almost where you're standing now, to brush my teeth without being short of breath and needing a ventilator by the time I got back to my bed, to being able to run on the streets of London for 4 kilometres non-stop without oxygen. And at that point is when I saw the lung transplant team. They weren't only happy with my improvement and not only agreed that the transplant could be put back, but actually said that they didn't need to see me at all. They discharged me from their care. It's been 26 months now since I saw them, and I haven't had to go back to see them, and I haven't even come close to needing to go back to see them.
So now you're both trying to inspire others, other people with conditions, to use exercise and activity.
Well, I have a chronic illness, and yes, it involves my joints and not my lungs. There's a lot of what we've achieved, and the idea is to really break that down and to deliver that message.
He's going beyond just telling the world that exercise is good for you, which really shouldn't be big news, but talking about the barriers that people with chronic disease have when it comes to exercise. Clearly, if you're in pain like Johan is, or if you're short of breath like I am, the idea of exercising is counterintuitive to making you feel better and definitely not what you want to do. So starting alone, there's a barrier, but then when you continue to push yourself, there are further barriers there. People will get flares, people will get ill, they'll lose their gains. How do you motivate yourself back? And so the conference in March essentially were a mixture of patients, family, friends and healthcare professionals sharing their stories and experience to how they can help people with that. And the exercise doesn't have to be marathons, it doesn't have to be running to Barcelona, it can be playing with your grandkids, it can be dressing yourself, it can be walking to the shops. I still struggle just going to work every day in the same way I struggle cycling to Barcelona. So these problems, these barriers and the things that can help to push through them are still absolutely applicable to everybody with chronic disease.